Hey, it's Ed here. Today I'm talking about access and awareness to treatment options, especially for those who are struggling with opioid use disorder, struggling with pain pills. And heroin is a huge problem. Once they can't afford their pain pills, then they move to heroin. But the problem is we don't have enough treatment providers to tackle this problem. In Kootenai County, North Idaho, where I live, a population of 157,000 people, and we have 12 providers. Those providers say they have between 30 and 150 patients. At max capacity, that's not enough to treat the number of addicts that we have in North Idaho and Kootenai County. We need more providers, better providers, and medically assisted treatment is great, but you need counseling. When you put someone on Suboxone or Vivitrol or Subutex, we still need to address the why. Now we've got them over the withdrawal, so they're no longer craving, their brain isn't screaming for that heroin or oxy. They actually have a chance to recover. But it's not a long-term solution. Having them on another medication is just not a long-term solution. We need to treat the why. Why did they start using and get them over that hump? And this is a long-term process. It takes 3 to 5 years to get that brain rewired. And in Kootenai County, from 2012 to 2016, we had 90 deaths from opioids. And that's probably a low number because they don't always get counted. And as we know, in the last couple of years, use has dramatically increased. From 2017 to 2017, it went from 64,000 deaths in the United States to 72,000 deaths. So I can imagine the same thing is happening in Kootenai County. So we need to provide better access. We need to provide more resources. The problem is, treating addicts is a difficult business, and not every doctor wants to take that on. And there's some hoops that they have to jump to make sure that they are qualified and that they know what they're doing. And we have a doctor shortage, we have a counselor shortage, and until our government steps up and starts providing more funding for residents, we're never going to sorry, I got a phone call in the middle of all of this. We're never going to get enough doctors providing treatment that we need. Now we have a lot of nurse practitioners and LPs that are taking this on, but like I said, it's a tough business, and not all of them want to add that to their practice. So we need to figure out a better solution. And until we tackle this in a new way, instead of just throwing people in prison, throwing people in jail, short-term solutions, 28-day rehabs that are very expensive, we're never going to reduce this. We need to figure out why people are using drugs and alcohol at an alarming rate now. We need to figure out solutions that treat it long-term. And until we do that, next year it's going to go from 72,000 in 2017 to, was it going to be 80,000 people die? 90,000 in 2020? I don't know where it's going to stop. But we need a fix. We need a solution. We need it now.